Okay. Thank you very much. I want to, as always, thank the press for your commitment during this time, this difficult time. I'd like to give a special mention to our first responders, medical professionals, and all essential workers who are doing important work day in and day out. And that includes all of the hospitals and the health centers in our area. I want to thank everyone who's been practicing social distancing to help slowing the spread of the virus. We'll start with our updates as of yesterday. There were 4,257 cases of COVID-19 in Massachusetts. There are 614 of those cases here in the city of Boston. 47 people have had full recovery, thank God. Unfortunately, 2 people in Boston have lost their life to this virus in 44 statewide. Our hearts go out to the families in this very difficult time, and we want everyone else to know that we're working around the clock to slow the spread, keep people healthy, and prevent the loss of life. We are fully committed to protecting all of our residents. Every single life is worth saving, and every single life is worth protecting. I'd like to just share a few updates with you about our work to protect our most vulnerable populations in the city of Boston, and one of those populations are people experiencing homelessness. In the past week, we had our first confirmed case of coronavirus in our homeless community. We've spent the last several days preparing for this moment when the coronavirus affects our homeless neighbors. But really, we've spent the last several years improving our ability to protect the health of our homeless population no matter what challenges come our way. We've built one of the strongest support systems in the country for people experiencing homelessness. We're working closely with our great nonprofit partners. We've gotten thousands of people off the streets into safe, supportive housing. We've engaged with people to build trust and to make sure that they're aware of the resources that are available for them. Right now, this network is allowing us to act swiftly. Today, I can announce that we have secured hundreds of new beds for people experiencing homelessness. These additional beds will ease the burden on our shelters as they practice physical distancing. And they will provide more safe spaces for homeless individuals to safely quarantine. Suffolk University will be repurposing a dormitory building that will provide 172 new beds. This facility will be managed in collaboration with Pine Street Inn and Boston's Public Health Commission. We're also repurposing a former hospital on Commonwealth Avenue in Brighton, which will have 70 new beds. This facility will be operated by the Boston Public Health Commission in partnership with the Boston Healthcare for the Homeless. We expect to have more locations coming online in the coming days. We are working with some of our city's large institutions and property owners, and we'll continue to make sure that we have enough spaces for all of our homeless folks. I want to be clear. People in need of homeless services should not go directly to Suffolk or the new site on Comm Ave in Brighton. They should go to one of our existing shelters, which will remain open, including Pine Street Inn, Woods Mullen, Southampton Street, Boston Rescue Mission, and Rosie's Place. The Boston Public Health Commission will staff and screen individuals and determine where they should go for their treatment. This will help us ensure that everyone gets the help that they need. This has been a team effort, and it's a good use of the resources that we have. That's what a strong city does. When people are in need, we come together to help them. We get creative and we figure it out. I sincerely want to thank Suffolk University for stepping up to the plate and getting these facilities ready so quickly. I also want to give a shout out and thank the neighbors and businesses in the Brighton area and in Beacon Hill for your compassion and your understanding. We are committed to keeping you informed as partners as we move forward. I also want to acknowledge the other Boston colleges. They are helping us and they're supporting our efforts in as many ways as we need. They're always good neighbors, and we appreciate their willingness to help. The 240 beds that I just mentioned are in addition to the 55 beds we've already created in the rear of the Southampton Street shelter. We're also working closely with the state to repurpose the Newton Pavilion at Boston Medical Center, and we will temporarily reopen it to meet the medical needs of homeless residents affected by coronavirus. The capacity at the Newton Pavilion is 250 beds. Altogether, these facilities account for about 550 new beds for the region's homeless community. This will help us adapt to this growing public health crisis and keep more people healthy and safe. This expansion builds on the work that we've already been doing with our homeless population since the crisis began. And all of our shelters remain open. We have conducted regular deep cleaning and sanitizing our facilities. Our street outreach teams are still working every day to engage with the people that need help. I want to thank all of our street outreach workers who are on the front lines, as I said the other day, and doing the work, showing up every day. We're also staying in close contact with people who are formerly homeless. Our city service agencies have reached out to do a wellness check for about 1,000 clients who have been housed in the last year alone. We want to make sure that everyone has the supports they need to stay healthy and to stay housed. Last week, I announced $2.5 million in grants to healthcare for the homeless, Pine Street Inn, and the Boston Medical Center to strengthen healthcare systems for the homeless population. These organizations were the first to receive money from the Boston Resiliency Fund. The city is also hiring important positions, including homeless counselors, public health advocates, and public safety officers. Anyone that's looking for a job in those areas, please go to bphc.org. That's bphc.org for job listings. Protecting our city is a long-term effort. We will continue to ramp up resources as necessary, and will continue to serve the vulnerable people in our city with the care and equity that they deserve. I have a few more updates and reminders. Most people are doing a really good job with social distancing, which is going to help us slow the spread of the virus. As you can see in some of the newscasts and reports that we got here yesterday at City Hall on 311, people are still gathering in groups and playing sports in our parks. This is not social distancing. Gathering in a parking lot, sitting in a round circle and having conversations is not social distancing. We are taking new measures to discourage anyone from engaging activities in our parks that will put themselves or others at risk. And quite honestly, you're putting other people at risk by doing this. This includes sports like soccer, street hockey, basketball, and tennis, and other sports that are going on. We already started to temporarily put zip ties on basketball hoops. We're putting new signage up this weekend, and the last effort is to lock the park down. We don't want to lock the park down because we want people to be able to walk through the park. There's no playing in tot lots. We want to prevent the spread of the virus. Young people might not think that you're in danger here with the coronavirus. The numbers say, number one, you can catch the coronavirus, but number two, you're carriers. And you can bring that virus into your home and affect your grandparents and an older population inside your home or your parents. So we're asking people to be very, very careful here and to really adhere to what we're talking about. Yesterday, I got several calls. There were open houses in the city of Boston. Realtors were showing property. We asked all realtors to stop doing open houses, and we're asking people, if you're going to show somebody an apartment, to show them by appointment only and don't have signs in front. So we're asking everyone to adhere to those rules. I also want to remind everyone that if you experience symptoms, self-isolation, and call your medical provider, 311 is something that's really important for you to do. Don't call 911 or show up in an emergency room unless there's an emergency. So call 311 if you can't get in touch with your provider, and we will work through our Boston Public Health Commission to have somebody screen you. Also, last week, the governor announced a new statewide resource, free online COVID-19 screening through Bowie Health. Based on your symptoms and your risk factors, they can then connect you to a telehealth resources covered by your insurance. If you're looking for more information on that, go to bowie.com/mass. That's Bowie, BUOY.com/mass. Yesterday, we opened our first responders testing facility in East Boston. It's a joint effort between the Boston Public Health Commission and the East Boston Neighborhood Health Center. This site is helping us make sure that our first responders stay healthy so they can continue to keep our entire city safe. I want to make sure that people understand that this testing site is focused on serving Boston's EMTs, firefighters, and police officers. If you're looking for tests, you should contact your primary care physician, or again, call 311 if you're in the city of Boston. If you're listening, obviously, and you're not in the city of Boston, you can get connected to the state by calling 211. We're also continuing to serve students and families while the Boston Public Schools are closed. We have more than 70 sites across the city that we're distributing free meals every single weekday. Some of these sites are also providing free hygiene and menstrual products. We're reaching out to families of special needs students. We've begun to deliver meals to them as they need it. We've also distributed over 21,000 Chromebooks for online learning at home. If you want more information about any of this, specifically about school sites or food distribution, you can call 311 or you can go to boston.gov/coronavirus. Senior food access is also important for us. We're also reaching out to seniors and making sure they have the support they need right now. We're supporting nonprofit partners that provide food for many seniors that they rely on. If you are a senior and having trouble accessing food, we're asking you to call 311, speak to our Age Strong Commission, and we will make sure that we connect you with services. Anyone facing food insecurity can also contact Project Bread at projectbread.org or the Greater Boston Food Bank at gbfb.org, or you can call 311 and we can get you those numbers. These great organizations can help you find meals and sites in your community. They've done amazing work over the last 50 years, and right now they've really done amazing work stepping up. We're creating also, as far as transportation in the city and traffic and driving, we're creating a 5-minute pickup zone for cars in front of restaurants. Restaurants can request a pickup zone at boston.gov. Also, residents with a valid residential permit sticker are now allowed to park in metered or 2-hour parking spaces with no time limit or meter fees within their specific neighborhoods. Until further notice, the Boston Transportation Department will no longer be issuing tickets for expired inspection stickers or registrations. The city is going to continue, and we start street cleaning this week, but there'll be no ticketing or towing for street cleaning. Other parking rules include parking meters are in effect to ensure public safety. And I also just want to make a couple of reminders. There is no parking in handicapped spots. You'll get a ticket for that. There's no parking in front of hydrants, and there's no parking in front of crosswalks. And I ask people, when you go shopping, if you pull into a handicapped parking space and your loved one runs in to pick a few things up and you're just sitting in the space with the car running, you're taking somebody's spot away. So we're asking you, do not park in handicapped spots. Keep those spots available for people that need this parking. So don't be sitting in there waiting for somebody to come out or any type of handicapped spot, because that is causing problems. I'm hearing that as well. Finally, I want to stress how important it is that we all treat each other with compassion and respect right now. As I said yesterday, and I'm going to continue to say, I'm deeply proud of the people of Boston and showing us what our city stands for. The vast majority of people are rising to the occasion. They're doing their part by social distancing, calling their neighbors to check on them and offer assistance. They're sharing positive online messages. This is how our city is going to get through this crisis. We get through this together with love and making sure we look out for each other. I want to express out to the recovery community. You should contact Central Service if you're looking for a meeting. Most Alcoholics Anonymous groups and Narcotics Anonymous groups are meeting online now. So if you reach out, they can get you the information that you need, and you can have a meeting online. I did my first one the other day. It's not like being in a building, but it certainly helps us get the meetings we need. And my last thing to everyone is that, as we see these numbers rise, we have the ability within our own means to stop this virus by social distancing, by physical distancing, by doing what's suggested. Again, as you look around the country and you see some places that the numbers are skyrocketing, a lot of those places, the mayors in those places have told me, shut down as much as possible and try and get ahead of this as much as possible and continue to express to the people of your city the importance of them doing this. By doing that, we can get out the other side quicker. So I want to thank you. I want to open up for questions.
Mayor, we spoke with the woman the other day who was looking for a place to stay. She said she not treating it. They're turning people away because they told her that people tested positive.
No, that might have been, there was a positive test the other day. That might have been in response to that. And what they would have done is give her another area, another location to go to. So we have other facilities. So I think that all of those programs and procedures are worked through now. I think that particular day, it might have been the day where somebody they were worried about somebody testing positive. So I think they are being directed to other facilities. And that's why, quite honestly, we're building this support. So now when we have somebody that's symptomatic, we have a place to bring people. We have somebody that might test positive for coronavirus, we have some place to bring people. That system is up and running right now.
It's a comprehensive plan. Was it because of seeing an uptick in testing why you were able to implement it so quickly?
No, this is one of the first plans that the healthcare providers and the homeless providers started working on right away. It's just the challenge of finding the locations that we can put people, the staffing of those locations, and making sure that we get the proper medical equipment. The organizations in Boston, like Healthcare for the Homeless, have been outstanding, and now we're just trying to think about if we need these, and we're going to need a lot of them.
You mentioned the zip ties for basketball nets. What other steps is the city taking? In a sense, you're taking out goals being taken away. What type of enforcement can you do?
Well, thank you. The question is, what type of steps can we take as a city? What type of steps are we doing here? I honestly don't feel at this point it's my job or our job, our public safety officials, to enforce these rules. It's about all of us working together. And I would ask, I know kids are antsy and parents are antsy with the kids in the house, but we have to have conversations, sit our kids down at the table and talk to them about the seriousness of this. And we have to help each other. I mean, we're not going to be arresting people. I don't want to be fining people. That we shouldn't have to do that. By now, everyone understands the severity of the coronavirus, so most people should understand the severity of the coronavirus. So it's our entire community. So I need help in the kitchens, in the houses, to have conversations with your kids and with people, and parents as well. I've seen pictures of people gathering in parking lots and hanging out. And letting their kids play together. That's not what we're asking for. What we're asking people to do is there's a stay-at-home advisory, which means we're asking you to stay at home. If you go for a walk and you walk through your neighborhood and you do practice social distancing, that's fine. We're not asking you to have people over your house and have parties at your house. We're not asking you. That's not part of a stay-at-home order. That does not help us. As we're seeing these numbers continue to rise. We need to level this off, and we're not going to see this leveling off probably for another couple of weeks. But all the work we do today will benefit us down the road when the testing continues and we start to see, hopefully, these positive coronavirus cases start to decline. I didn't say the last part of your question. Yeah. So the question is, there's two questions, and I'll have Marty answer the first one in a minute about the Brighton Hospital, what's repurposed. The second question is dealing with Melnina, Mass Ave, where we have some serious concerns of people that are addicted and struggling with addiction. We have our staff and our counselors out there still trying to get people into treatment. I think in certain cases we are moving people around the city best we can, but we also I went by there 2 days ago, there was no one down there, and today they're down there, so it's kind of on a sporadic basis. So we have our counselors, when people are down there, going out and talking to these folks, checking in with them, and we're also still trying to get people into treatment as best as possible, getting them as much information as possible, understanding that they're all susceptible to the virus as well, and trying to, again, they're Bostonians, or they're from they're Americans, so we need to do everything we can to help them. Dispersing them, that's something that we can talk about. They should be practicing social distancing, and I think our counselors try to express that to them as best as possible. I'm going to ask Marty if he can address the question is on the location in Brighton, what hospital it is.
So the location in Brighton is at 1515 Commonwealth Ave, a former hospital that has roughly about 70 beds, and we'll be partnering not only through the Health Commission but through Boston Healthcare for the Homeless to be able to provide additional resources for folks. We've been able to lift it up in short order, and it stands ready to be able to take people as needed, even as of tomorrow.
Oh, hold on 1 second. Did I get everything? You got everything? Okay. Yeah. Yeah, we're in constant contact with our hospitals, with the state. Marty Martinez is constantly on the phone with the Department of Public Health of the state. There's constant conversation on that. And I think that, we're all monitoring the capacity in our hospitals, and the hospitals clearly are worried about the capacity as well. So we're looking at different things. So for example, the facility that's in 1515 Comm Ave for our homeless community, that potentially could be keeping folks from having to go into the hospital, and we can monitor their situation, their status. That's one of the reasons we're doing this. You look at the East Newton Pavilion, same situation. So we're looking at how do we try and help as many populations as possible so we're not overloading our medical facilities and only the more serious cases go there. A lot of people are that have tested positive for coronavirus. They're not all in need of hospital care. Many people are self-quarantining at home and trying to get through this at home and staying in constant contact with your doctor. So we're constantly working with what capacity needs are available, and we're going to help the state in the hospitals in any way need possible, that if we need additional capacity for hospitals. I think the biggest thing in the hospitals, what I'm hearing, is the staff. You know, can you imagine being a nurse or a doctor with a family, and your job is to take care of sick people, and they do it really good here in the city of Boston, and they're very proud of their work, and then they're concerned about their families. And I think that that's some of the things that, you know, I want to work with the hospitals on, and make sure that our nurses and doctors understand they have a lot of supports by all of us out here. And I think that, you know, this is you can only imagine that the concern of a worldwide pandemic, the effects it has on people, people's psyche, including my own. I mean, when you think about that, and we just have to continue to support them. But we haven't heard. We're staying. Literally, it's hourly conversations with the hospitals. To my earlier point, if we have young people playing basketball in basketball courts, and we have young people playing street hockey in street hockey courts, and we have people down the beach, hanging on the beach, and we have people sitting in large groups of people and large groups and having conversations, and if you have a wine party at your house or a house party at your house, all of that, all you're doing is going to put a bigger strain on our hospitals, because more people are going to test positive for the coronavirus. So that's why it's so important for us. It's hard. I mean, it's hard for all of us that appreciate freedoms and being able to live our life that we can't right now. And unfortunately, you know, I'm hoping that no other generation of people have to experience what we're going through right now. But in 1918, Americans had to experience what we're experiencing now, and they didn't have the same information. They didn't have social media. They didn't have the same way of getting information out to people. It was a lot of word of mouth in the newspaper, how often it came out. Today, we can give up-to-the-minute news and up-to-the-minute information. So I'm asking people to please, you know, work with us here and work with everyone. And as I mentioned yesterday, if you're not concerned about yourself, be concerned about your neighbors, your family, your friends, and people around you. I mean, one of the things it does, it allows the governor to activate. He activated the National Guard, have the National Guard working in here, and also I think it will help us hopefully getting some equipment and resources here quicker. It's a procedural step. It impacts the state more than it impacts the city, but allows us the opportunity to work with the state to get resources. No, it just started yesterday. We'll get that information. We're trying to figure out as we're trying to like. It worked well yesterday, but we're trying to see what our capacity is and how many. You know, we have a set number of tests that we can use. We're working that out as well. Is there an ability for us to increase that later on down the road? So we're still working out. The next few days, we'll have information for you on that.
Just a little bit. How many city hall staffers are working at this point, and do you think that's
Oh God. Yeah, most of the people here. I don't have the percentage. I'll get that feel later tomorrow. But I think, you know, I would say the folks that are working on the front lines are our police, fire, EMS. We have the mayor's office staff working on planning and preparation as we move forward here. We have folks working in our transportation departments, in our public work departments, in our parks departments, in our water and sewer departments, dealing with emergencies and things like that. But the vast majority of the folks that we have working here in City Hall are working remotely from their home. We're also asking people, and I didn't say this, you know, don't come to the building for a call. If you wouldn't mind, call to set up an appointment if you need something. We basically shut all public-facing windows down. They're still open, but you have to do it by appointment. So you can't just come in here and get something. So we're asking that. So for the most part, I want to thank the public employees, the City of Boston employees, and throughout the Commonwealth, quite honestly, that also are not home with their families, that are working, making sure that as we talk about what we're doing here today, you know, even just this press conference, a lot goes into it, a lot of information is provided, so it takes a lot of people to make sure we have the accurate information so you can report the news accurately, what we're giving you. So I want to, again, thank you for that. I don't know how many we need. We're still assessing that. So, for example, the question is for people listening, where are we on the Chromebook and the assessment and needs? When we closed the district down, the schools down, we made a decision on a Saturday to close the school down on a Tuesday, and we started the conversation about what kind of technology people need. Families have different levels of technology in their homes. Some families have computers and Wi-Fi, and other families don't have Wi-Fi or didn't have computers. So our school community was literally reaching out to all of our kids to find out what capacity they had at home. To date, we have given out 21,000 Chromebooks to deliver to students in our district. I will get you some numbers of what's left to do. I think I heard on a call today there's a couple hundred left. A lot of our families have the technology, so they didn't need the Chromebooks. We also are working with our cable companies and our internet providers to provide free internet service for those families that have the Chromebook, and they've been very helpful. I want to just give them a shout out for their support and assistance as well. But I think we have a few hundred Chromebooks left to deliver, from what I understand. We can get you a whole breakdown because I think that's a different price story you want to do. All right, any questions? Any more questions? All right, thanks everybody. Stay safe.